Okay, so a little advice about
we're talking breast cancer.
So you have found a lump in the breast. Don't panic.
Yeah.
It's actually a good thing, because if it happens to be a breast cancer, then great, you caught it early, and let's do something about it. So what do you do? It depends on who your primary care doctor is, but you want to be referred to a breast center or a breast surgeon who is on board with doing oncoplastic type surgery. So that might be a plastic surgeon that you know already, who is you've used for different things. It may be your GP, it may be your gynecologist. For many women, especially younger women, it's their gynecologist. So what you want to do before you go down any diagnostic path is you'll have a mammogram typically, and many times an ultrasound to evaluate the mass. And if the mass persists, or if it's suspicious, then they'll either delay it a little bit. They'll say, well, let's wait a month and see what happens. Or they'll say, let's just go ahead and do a biopsy. And the biopsy is done with a needle typically. And from that very point, before they do the biopsy, you want to be taken care of by a group of doctors who are completely on board and understand oncoplastic surgery, that is, using plastic surgery principles to apply to breast cancer surgery, so that if the biopsy is taken through part of the skin, it's taken through part of the skin that's going to be removed anyway, and it doesn't cause additional scars or a need for removing skin because it was in the needle track point. And then once let's say that lump turns out to be a breast cancer, then basically you'll go down the path of lumpectomy and radiation, and many times type of chemotherapy versus surgery. I would encourage all women to consider having nipple-sparing mastectomy. Whether you have a small breast or a large breast, nipple-sparing mastectomy can be the answer for you, because it's removing a very, very high percentage of the breast tissue that could become cancerous later, as well as the breast cancer, and it should obviate the need for a breast radiation or chemotherapy afterward, because having a nipple-sparing mastectomy is equally effective as a traditional mastectomy. And as long as you're going to an experienced group or doctor, plastic surgeon, usually it's a plastic surgeon, breast surgeon combination, most of the time you can have a very nice cosmetic result and a very effective oncologic surgery at the same time. So
great.
That's my 2 cents worth.
That's good.
Really? Do you have anything to add?
No, I agree with everything you just said.
She doesn't agree with
No, I do.
What don't you agree with?
I agree with everything.
Well, why are you standing there making faces?
Because I have patients I have to go see.
That you wanted to make these breast cancer videos now. I'm just saying,